Telling our team as we were getting ready. I'm notoriously bad for remembering to hit record. So we've done it. We're off to a good start already this morning. So welcome, folks. I will ask my team who are on, if you could just keep an eye on the waiting room for me. And if you see folks coming in, let them into the room. We'll welcome them as they're able to join us. So we are here today to talk about the 2022 Research and Development Prevention Fellowship resources and products that were developed during the course of our term, which is coming to an end today with the symposium. And I'm very excited to tell you all what the fellows have been working on this term and to present to you the products and resources that they created. I think that these are going to be really useful to folks in the different states as we are navigating the changing landscape of cannabis in New England. So a couple housekeeping things and some disclosures before I turn it over to the fellows to tell you about the really wonderful research they've done. The event that you are about to participate in is provided through the New England Prevention Technology Transfer Center. We are funded through a cooperative agreement with SAMHSA. And the thoughts and opinions and views that you hear and see today are those of the presenters, not necessarily those of the federal government. The PTTC network and the New England PTTC believes in using person-first language. The use of affirming language inspires hope, and we know that language matters and that words have power. So we will all do our very best to use person-first language today while we're talking, and we ask that in your conversations and any questions that you may have for the fellows, that you try to do the same thing. The New England PTTC acknowledges that we live, work, and operate on the traditional lands of Native people. We operate out of Augusta, Maine, and these are the ancestral lands of Abenaki people who are a part of the Wabanaki Confederacy. We believe that we have a responsibility to acknowledge those Indigenous connections and the history of Indigenous land disposition. So if you also are interested in learning about the land that you live, work, and play on, we would encourage you to find out more about the stewards of those lands and to work with your Native neighbors who may currently or in the past occupied those lands. And if you want to learn more about who those lands belonged to, you can visit native-land.ca. There are a handful of websites that have a similar function, but we find this website is really user-friendly, so we recommend it. So first things first, I'm going to turn it over to our wonderful fearless leader, Scott Gonyer, who's going to give us a brief welcome. Scott?
Thanks, Sarah. I want to welcome everyone to our symposium today. Really happy to have you all here. I noticed we have folks from our region here in New England and folks from outside the region, so welcome everyone. Really excited about this presentation. So this is the second year of our fellowship program, and this program really ticks a couple of boxes for us. One is it's an opportunity for us to offer a sort of workforce development opportunity for more kind of advanced and experienced prevention professionals in the field, because that's something we've learned as we stood up our PTTC here. There was a real need in the region. The other couple of boxes it ticks off for us is our specialty focus area is cannabis prevention. And one of the reasons for that is, as I think everyone understands and knows, is that the landscape is quickly changing in our region, and really all 6 of the New England states in different ways. And so another, I think, brilliance of this program is it offers an opportunity to provide 6 unique products responding to 6 different needs, because we know cannabis prevention is a very complex topic and there's different needs and areas that need to be addressed. So I think you're going to find that these products exactly meet that need, providing 6 unique products that are going to address different issues that hopefully translates to some of the issues you're dealing with in your state. So definitely take notes. We'll be recording this, and the products will all be posted, so we hope you can put them to use in your region. And I look forward to seeing the presentation. So thanks again for joining us, everyone.
Thanks, Scott. Okay, so before we dive into the new resources that will be available to you after the symposium today, A few pieces of information about the fellowship for those who are interested in what the program looks like and what the 6 fellows have experienced over the course of the last 7 months. So the research and design fellowship really has 2 pieces. One piece is some intensive TA and some advanced professional development for the 6 fellows who are part of the program. So they really get a really intense many month long period of time to do a deep dive into a subject of research that they're passionate about and interested in, which is something that often folks in prevention don't have an opportunity to do that deep dive because we're busy working at our jobs. All of our fellows who are on the team also were busy working at their jobs. So this is a second project that they were able to take on. But one great thing about our fellowship program is that there is a paid stipend that comes along with it to help support some of that work, because many of us are always doing passion projects, but they don't always get funded. So that's one thing I love about this program. But the other piece to this program, besides the professional development for some advanced level professionals, is providing these new and innovative resources to the workforce in New England. So each fellow had a different focus. Some focused a little bit more state specific, and some broadened their projects out. Whoops, somebody's come unmute. Some have broadened their projects out to the New England region as a whole. So I'm hopeful that you'll be able to find some applicability to your work, regardless of whether or not your fellow or the fellow who you hear speaking was from your state or not. There should still be some applicability to you. So the hope is that whatever state you're coming from, you will have 6 new resources that you will be able to draw from as well. So you've heard it a couple times from Scott and in probably the reading you did before you came today. But our priority subject area for the 2022 term is the changing landscape of cannabis in New England, with a focus on the IC and RC prevention domains. We have, as Scott said, seen a lot of changes in New England over the last few years when it comes to cannabis and the different levels of legalization we have state to state. And we have had a lot of requests at the New England PTTC for more information around cannabis and the changing rules and regulations. So we really felt like this was a good time to address this need. As you see in the picture, we had another fellowship term last year with a priority subject area of diversity and intentional inclusion and prevention. 2 of the fellows from last year are joining us again this year as senior fellows, so you'll hear a little bit from them. And if diversity and intentional inclusion in prevention is something that you're also interested in, you can visit our website to see what the products from 2021 were. So these fellows have been hard at work since May. We have 4 meetings as a cohort so that the fellows can have some team cohesion and learn from each other and bounce ideas off one another. But the program is very self-directed as well. So we had these 4 meetings and then our technical meeting, and now we are here in our symposium. We always set a goal to have our products and tools published for the workforce to use by the end of December. But our team and Jessica on our team are very quick, so we will have those ready for you actually at the end of the symposium today. We'll even get you a link so you can access those immediately. So our 2021 products are available on our website, and I wanted to just give a special shout out to our main product from last year. It kind of combined the intentional inclusion and diversity aspect of last year with some of the pieces that we're going to be talking about this year, which our fellow did not know that last year. But for those of us on the call who are particularly interested in the cannabis issues, the product from last year was the Cannabis in the United States, a toolkit for non-citizens. Her product, Lori Jevons, did focus that product on the state of Maine, but there's a lot of great resources for folks outside of the state as well. And that resource has been translated into, I think, 8 languages that Lori identified as being priority languages for our state. So if you are interested in sharing that with folks, you can find that on our website now. And if you're in the New England region, Scott and I are always traveling around somewhere with copies of those, so we can get you physical copies as well. So with that, I am going to turn it over to our fellows to start talking about the wonderful products that they have done a lot of research and a lot of hard work developing for you over the course of the last 7 months. And Dan Fitzgerald is going to be our first presenter. So I'll turn it over to you, Dan.
Wonderful. Thank you so much, Sarah. And good morning, beautiful people. There's so many of us across our region and beyond on today, which is really exciting. I first off just wanted to say thank you to the New England PTTC and their staff just for this incredible opportunity and in this investment. As Sarah alluded to, I was honored to be a part of the fellowship last year, and it really offered me an opportunity to pull together a resource guide around intentionally inclusive prevention practices with and for the LGBTQ+ community. And over this past year, or 6, 7, 9 months, whatever it's been, it's surely went fast. I've heard from so many of you who have been able to put that project that I pulled together last year into practice in your own communities, which has been really, really exciting. And this year, I was able to build off of some lessons learned in my own community and work to craft an indicated prevention program rooted in research and best practice designed to be an alternative to suspension offered in schools. As you could likely guess, this project falls within the prevention, education, and service delivery IC and RC domain. Before I talk about my program, I want to just take a quick moment to tell you a little bit more about me. So, hi. My name's Dan Fitzgerald. I come from the small but mighty state of Rhode Island. I think, put it in the chat, but I think half our state's here, which is really exciting. I use he, him pronouns, and a fun fact about me is every few years my birthday falls on SAMHSA's National Prevention Day that kicks off the Cattica Conference. So to me, I take that as I picked the right profession. So that's a little exciting fact there, but I'm really honored to hold several volunteer and professional roles. Today, I come to you as the executive director of the Charahoe Youth Task Force. We're a 501c3 nonprofit. We operate in Southern Rhode Island, and we lead the substance use prevention, mental health promotion programming in our Tri-Town area, and we're a proud member of the South County Regional Prevention Coalition. I could spend the full time telling you more about our organization, our work, but I'm guessing you're probably here to learn more about the project I did in this fellowship. So let's dive in. So probably there's a lot of really cool facets of this fellowship program, but I think the thing that is my favorite is that the PTTC team requires us to really dig into research before we ever put pen to paper. So I ended up reading dozens and dozens of research studies, peer-reviewed journals, really all around the efficacy of punitive school-based punishments, restorative justice, and alternative to suspensions. I will save you the 2+ months I spent dissecting a lot of that research, and I will give you the SparkNotes version. This may be shocking to some of you on the phone here, but suspensions don't work. Wild, right? So the research found that zero tolerance policies did not work. Specifically, there was not meaningful change in substance use, and in many cases, it actually led to higher use, disconnection with our students, dropouts, and more likelihood to get involved with the juvenile justice system. And really, my passion point for diving into this was really honing back to my community here in Southern Rhode Island. Our community was facing this conversation and this reality about 4 or 5 years ago. So our prevention coalition, we worked alongside the administration at our regional school district, and we really tried to build a solution. But what we were finding is that students who were breaking our school substance use policy were getting suspended, and more often than not, they were then reoffending within the next month. So this was clearly not working in the short term and very likely not working in the long term. So they reached out to us, 3 members of our team, Terry, Rebecca, myself. We worked to create and staff a monthly prevention education retreat program. And almost immediately that first school year that we worked on that, we had nearly no students come back through that disciplinary system following the elements of the program. We certainly didn't get it perfect. It's something we've worked to refine over those years. And we also found several other really interesting results. So let's take a look at a quick case study. This is something that you can see in a lot more detail in my final project, but what we found is not only was there a measurable knowledge transfer between our pre and post testing, but we were able to also measure a significant change in the perception of harm of substances that we discussed. Most notably when it came to cannabis was around vaping and smoking. So I pulled some more information from our lessons learned. I pulled information from our research. And during this fellowship, I created a cannabis-specific indicated prevention program meant to be used as an alternative to suspension program in schools. So let's see what's in the final product that you all will get the link to very shortly. So really the first place that I would hope that if you're interested in this program, I hope that you start with the program guide. So this highlights the research that I discussed in greater detail, the case study from my community that I talked about in greater detail, and all of the tools that you need to implement this program. In the guide, you'll also see that school policy is essential to the success of this program. You'll find a sample student behavior code based on the one that we implemented in our school district. And what this does is it really institutionalizes the referral process to this educational program rather than the suspension that we talked about. The best practice in this policy also refers the student to an in-school student assistance counselor. The guide highlights other lessons learned, the timeline information that hopefully will allow you to replicate this in your community. And of course, the program includes the implementation tools. So let's move on and chat a little bit more about what's in that aspect of the program. So this alternative to suspension is a 4-part program, and it's designed to be either implemented in one sitting or broken up into smaller sections if needed. So the program takes an estimated 2 to 3 hours to complete in its totality. Section 1 covers healthy behavior change. This is really, as you could guess, the big goal of this program is to set students up for success to make healthy behavior change. The second section is on better understanding substances' impact in the young brain. The third section is a more comprehensive, multi-pronged section on cannabis. And this is everything from like methods of use, health impacts, consequences, so on and so forth. And finally, the fourth section brings the other pieces all together. It focuses on positive decision-making, coping mechanisms, and more. And an example of a pre and post test are included as tools for you as well. So as I near the end of my time, I want to highlight the other implementation tools that are included with the program. So each lesson has a corresponding activity for participants to complete and discuss before moving on to the next lesson. I did want to quickly talk about the first one, and that's for the healthy behavior change section. And this is actually a collaboration between me and the more creative, talented Fitzgerald sibling, my sister Rebecca, who's also a certified prevention specialist, and I believe is on the call this morning. This is built off of a program that she created designed to make the trans-theoretical model of change accessible, understandable, and relevant to students. Something I didn't think all those that could fit in one sentence before. It's something that I know I learned in a grad program. But the cool thing about this is this activity actually enables students to use an interactive quiz that Rebecca made, think like BuzzFeed style online quiz. And it can really help determine what stage of change that they're in when it comes to their cannabis use. And as you can imagine, this is not only helpful for the student, but especially for the facilitator to know as you go through the information throughout the rest of this, knowing where folks are, whether it's our community or a student, knowing what level of readiness and change they're at is a really helpful tool. And of course, this program also comes with a facilitator script packet that hopefully will make your implementation of this program as seamless as possible. So I hope this tool is helpful for you. I hope it's helpful for your community. I know I'm just about out of time, so I will leave you with my email. And I really would encourage you all to reach out. Feel free to read through all the final tools. I know there's a lot there, but let me know what you think. Let me know what your questions are. It's been certainly a labor of love, and I know that for the rest of this morning, as Sarah mentioned, we'll be opening up for questions after all the fellows present. But I know just from our conversations as a group, there's some really, really incredible projects that you'll be hearing about in just a few moments. So thank you for listening to me about my alternative to suspension program. And I am honored to pass the mic over to my colleague, Mariah Flynn from the beautiful state of Vermont. Thanks so much.
Hey, hello everyone. Thank you so much, Dan. As Dan said, I'm Mariah Flynn. I use she, her pronouns. I'm working in Vermont, and I've been working here for about 14 years as the director of the Burlington Partnership for a Healthy Community, the substance misuse prevention coalition that serves Burlington. And I've been in the field of substance use longer than that, working in treatment prior to this. And so I've been really excited to see our field advance here in Vermont. And so over the time that I've been part of the field here in Vermont, I've been able to help with founding a number of initiatives to coordinate our work at a statewide level, at a regional level, at a county level, and that's really advancing the field. And I'm excited now to currently be in the Vermont Prevention Academy, which is the first cohort to have a CPS or Certified Prevention Specialist certification that just came to our state, and we're all the folks of us that have been in the field for a while will be part of a legacy cohort to get our certification. So it's very exciting for us all. And probably most importantly about me, I do a number of prevention related things in my personal time, but one of the ones that I think gives me the most experience is that I'm a mom to 2 teenagers right now. So I'm learning a lot that way about how to create healthy communities for kids. So you can move ahead, Sarah. So because I've been in the field for a while, I've seen some of like what we have and what we might be missing. And one of the things that was a challenge for me when I was starting out in the field is the policy work, because I would look at some of the tools and the primers and the guides for doing that work, and it felt like there was a lot of good kind of baseline information, but nothing that got into the real specifics of what that looks like and how to get from point A to point B, from the problem you see in the community to the solution of an improved policy change, and what those steps in between and like real pieces of that were. So that's what I decided to use my time for, is creating something that folks in our field could use to help them get from point A to point B in a policy change work. I focus specifically on Vermont because in wanting to get really into the specifics, there's a lot about the laws within each state that will impact what you can and cannot do in your state. And so I focused on Vermont because I got specific to our law and what we can do around improving policy in Vermont. But there's a lot in the toolkit, I think, that will be helpful regardless of the state that you're in. My kind of vision for the future might be to take this and adapt it for each state so that there is some specifics for each state that allow you to really use it. But for now, this will focus on the laws that we have here in Vermont. So I also wanted to ensure that there was a real focus on what is the role of the prevention professional and how we in our field also ensure that the community has a voice in the work that we're doing around policy improvement. Sarah, you can move ahead. So inside, in the toolkit that I've created, you'll see some basic details about the Vermont's cannabis commercialization law. So we just in Vermont began a commercial cannabis retail market that started in October of this year. So you'll see kind of a timeline of where we started easing up on some of the laws around cannabis and then where we are today. And then I've broken it into local policy strategies that we can do in our state to focus on 3 specific areas: protecting youth, protecting health, and advancing equity. around this issue. And all of the strategies that are outlined are things that we can do based on what our laws and regulations are here in our state. And then there's some things around framing your message and what works and what doesn't work in terms of helping people understand these issues. I don't go into great detail about that because there are lots of other great resources for that. So I outlined some of those in the toolkit as well. I didn't want to spend too much time in this particular toolkit, including things that I know are already included in other resources. And one thing that I did spend a little bit of time on is putting some pieces in there that help us all think about how do we ensure that that when we're doing this work, when we're gathering people together to create change, when we're creating action teams to improve policy in a community, we ensure that we're committed to accessibility to that work for everyone in the community, and that we have voices that are representative of the folks that are most impacted by this, by the policies that we want to improve. And so there's some pieces in there to help us think about that. And then the piece that like I said in the beginning, I was most excited to get into, which is the kind of, how do you get from point A to what I call point C, the celebration at the end, when you've finally gotten from, we see a problem to we've been able to get the solution to the solution. So in there's kind of a timeline or a process by which you can get from point A to point C. And then I've included some additional resources in there to help with that process. So there's folks who work in the field might be familiar with a community scan, which you might do when you're trying to identify issues in your community. I've shortened that to what we found in our community was a more manageable community scan that can be used more as an engagement tool for helping new sectors or folks within the community kind of understand some of the issues. So that's included in the appendix, as well as a case study of a policy change that happened in my community that helps outline the importance of persistence in that work, because so much policy change really takes time and you have to be in it for the long haul. So helping folks to see that how you adjust and adapt over time, so that if if you're in this for a 5-year change, each year or each phase, you're adapting and changing and improving the work that you do the following year. And then I did, like I said, put some time into one of the things that I notice in our field sometimes, myself included, is that there's a real concern, I think, about the line between advocacy and lobbying. And for so many folks who are representative of 501c3s, we get concerned about crossing that line. And so I've seen people stay really far away from the line. And so one of the things I kind of advocate for in this guide is that we can get closer to that line. As long as you don't cross it, you're fine. And as you understand what the line is. And so there is a piece of this that really talks about our role as folks who understand the public health impacts of these changes in policy. Our role is really to make sure that we are advocating for the community and we are a strong voice in that work. So how to recognize that role, be an advocate, and then some tips for talking and communicating about those issues. I don't get into great detail around the next steps, those pieces of what are the talking points, because I think that there's some great tools around that, but also I know that Jeanette, actually, who will be talking next, kind of gets in a little bit into more specifics about some of those issues. And so you've got a great companion resource to what I've created with Jeanette's that can help with this work as well. And I just wanted to say thank you so much to the PTTC for this opportunity. This is, it's been really exciting to have this chance to bring to light some of the passions that I have and what I have been wanting to create for myself and our field. And I'm available. Please do reach out if you have questions about what I created. Thank you.
Hi, everyone. My name is Jeanette Dosova, and I am the fellow from Maine. So I wear a few different hats, as so many of my colleagues do, but I am currently the program director for Westbrook Partners for Prevention. For folks who are not from Maine, that's located in southern Maine. We border Portland. And my coalition is DFC funded, so we receive some federal funding, and a need that I saw personally in my community, but also just in having conversations with other colleagues throughout the state, especially emerging professionals, is this need for prevention specialists to interact with lawmakers, and some hesitancy around doing so, and some sort of, misunderstandings and a fear, not a fear necessarily, but an acknowledgement that there is some gray area for prevention professionals and the work that we can do when interacting with lawmakers. Mariah's presentation, the end of it was a great segue to my product. So you can move on to the next slide, Sarah. I created two different products. They go hand in hand with each other. So the primary product is a toolkit, really to encourage prevention professionals to approach their lawmakers, to have conversations about cannabis prevention with them, outlining, specific data points, language, health implications, things that can be used in having those conversations. And then really differentiating the difference between advocacy, which, I don't love that term for it. I think it's really more the difference between lobbying and education. So as prevention professionals, it's our duty to educate. It's our duty to raise awareness, engage with our community. But, we're limited, we can't lobby for things. So really dissecting the difference between the two and hoping to empower the folks that are doing this local level work to be able to have those conversations and not kind of avoid those. Because I know some people will be comfortable and will privately on their own time lobby for issues. They will say, I don't think you should vote for this, or you should vote this way because of X, Y, and Z. But on our paid time as prevention professionals, we're really able to only educate and present data and kind of just be a resource. And then my second part of the product is a modifiable slide deck. So I know that, as these things come up, we may not have enough time to prepare a thoughtful presentation to educate our municipal leaders. So this, I wanted some folks to have something that they could pull from, they could plug in their own logos, their own local level data. It wouldn't be recreating the wheel, and it would have some really good talking points. And oftentimes these initial conversations with lawmakers can be brief. So I know sometimes it's, you have like as little as 3 minutes to get your point across. So I thought this would be something helpful for folks to have. Like I said, you can really modify it to your own group or coalition's mission or needs. Moving on. So how to use these two products, really just to have educational conversations with lawmakers. Maine, I wrote this from the perspective of living in Maine and being a prevention specialist in Maine. And right around the time that cannabis use was legalized was when I was entering the prevention field. And it took some time between the vote and retail stores actually opening up. So it was a close vote in our state. There was a lot of unknowns, and I think the state really wanted to be thoughtful about laws, regulations, and the specifics before allowing establishments to open up. So our model in Maine is that the state kind of left it up to towns and cities to decide if they wanted to opt in and allow for cannabis retail sales. So as of September 2022, only about 10% of municipalities had opted in. And I mentioned, Westbrook and Portland. So Portland is one of the biggest cities in our state. It has a lot of retail cannabis shops that are open. It borders Westbrook, where I live. And Westbrook, even though they have some grow facilities, we currently do not have retail cannabis stores. So this was really a passion project for me, and thinking of, what are the needs of my community, but then how could I address some of those similar needs that other folks may be experiencing, not just in Maine, as more and more states are taking the legalization plunge. So we can move on. So really my hope for my products is that folks will feel more empowered. I think that it can be a little intimidating thinking about speaking with local lawmakers or politicians. We're not trying to necessarily influence their vote or stance on a position. We're just trying to make sure they have all of the relevant facts and data pertaining to making an informed decision. Hoping that this will lead to safer practices and regulations as the cannabis industry is expanded. And then I think it's also just good to raise community awareness, to be a present resource in your community. So if nothing, folks know, who you are, what your group or coalition stands for, and how to reach you. Establishing those strong community partnerships is really key. And I think that, educating local lawmakers, you might not necessarily have the intended outcome you're hoping for. Maybe you're hoping that your area will vote to not opt into retail sales, but maybe they do, but that's not a reason to feel defeated. I think it's a reason to continue establishing yourself as a resource and helping guide the policy development in the community. So there in the toolkit, there's also a list of things that you can do and initiatives that can be implemented if there are cannabis retail stores in your community. And then long term, I just really hope that, we can continue to making a dent in the low perception of harm and limiting youth use. And then just a little bit about the fellowship process as a whole. I think a few of my colleagues have already said this, but this was a labor of love. It was wonderful to be able to devote so much time to take a deep dive into a topic that was very interesting to me. And like I said, my community currently doesn't have retail stores, so I will be using my own toolkit and my own PowerPoint as the need for education for the municipality comes up. And everyone might be in a different spot with cannabis legalization and laws, but I think that there are very helpful things that you can pull from these products. And very, very huge thank you to the New England PTTC and my fellows. It was truly a pleasure to be able to bounce ideas off of each other and talk about the changing cannabis landscape in the country. So I really appreciated being a part of the program. Highly encourage folks to download all of our products and use them as you see fit. And you can always reach out with any questions to any of us. Thank you. And I will pass it off to my colleague, Ani.
Thank you, Janet. Hi, my name is Annika Stanley Smith. I was formerly the Director of Substance Misuse Prevention for the Capital Area Public Health Network and am now a prevention consultant. And I just want to take the opportunity to thank SAMHSA, the New England PTTC, and the folks at AdCare, because this is my first time even attempting anything like this. So it was a really easy process to apply for the fellowship. And I felt like I had a lot of support, not just from the folks at AdCare, but also from other fellows. So if you're thinking about applying, please do. I think you're really going to enjoy the process and the results. So we can move on, Sarah. So my strategy for my fellowship was to produce a toolkit around cannabis conversations. A lot of times people don't know how to start the conversation, or if they do, they kind of fall back on some ways of talking that are not productive. And so I really wanted to do it with a harm reduction lens and recognize that our friends in harm reduction, the specialists there, they have a lot of the same shared goals as us. They have a lot of the same strategies. And when we come to talking about cannabis, we can really use that lens to talk about the example from opioids, which is when we talk about opioid use disorders, we don't say that opioids are bad. We make sure that folks know that they can be used in a medical way, in a therapeutic way, in an appropriate way, while also helping explain that there is the potential for harm when their misuse is involved. So making sure that we aren't cutting people off from our message by being totally anti-substance, by saying, like, we understand that cannabis can be used in a therapeutic way. We understand that in some states it can be used in a medical way. So we don't want to turn people away from hearing about prevention and ways they can reduce the harm around substance use by totally cutting it off as something that's bad for you, when we know that for some folks it can be helpful. So this toolkit really takes that into consideration and makes sure that we're not talking in a way that cuts off our harm reduction folks from being a part of the conversation. We can move on. So what I really wanted to focus on in this kit was ways that we message frequently that do not work, and that we have multiple scientific studies to say, stay away from this, avoid this. So the top 3 things that I feel that we should avoid are, through the research I've found, are some of the most important things to avoid is unsafe language. So like at the beginning of our presentation, we talked about using person first language. It also means being factual and not lying or over exaggerating, and not using us versus them language, and really making sure that we're not demonizing people who use substances, right? So those are all ways where we can turn people off from our message and make it harder for people to get better. The other thing that we really should avoid is scare tactics. So avoiding using things like, if you smoke cannabis once, you're going to develop psychosis, things that we know are not evidence-based. Images of people melting into couches, images of scrambled eggs, those things don't help us, because we're not using brain science when we use that type of tactic, right? If we're trying to engage youth and change youth behavior, we know that consequences of use are not going to be something that their brain is going to understand. And it's not working with what their brain strengths are, right? Their brain strengths are the reward center. So how do we make our messaging focus on the things that actually work for their brains? And the last thing we really want to avoid is myth versus fact. So through the research, myth versus fact is shown to create confirmation bias, right? If we've heard the myth over and over and over again, when we restate it in our prevention messaging to say, don't say this, say this instead, all we're doing is confirming what people already know about the myth, right? So an example of that would be cannabis isn't harmful for your brain. When we say that first, instead of saying, hey, actually cannabis is harmful for youth brains, developing brains, it can be harmful to anyone. We want to make sure that we understand that. When we restate the myth, we're just confirming what people already know, and so they're just going to keep believing, oh, cannabis is harmless. And on the next slide, we'll see what we should be doing instead. So effective messaging is factual messaging. We're not overstating the harm. We're being realistic. We're not saying that fentanyl is in every substance we see, or 100% of cannabis is actually fentanyl. Things that are going to be huge exaggerations don't help our cause, because the instant that someone learns differently, then they'll stop trusting us as messengers. So we have to be really careful that what we're spreading forward is evidence-based, is science. Otherwise, people will stop listening to us. We really want to message the moral responsibility for our communities to say substance use prevention is all of our job. We're all gatekeepers when it comes to suicide prevention. We're all gatekeepers when it comes to substance use prevention. So the idea that it's part of our moral responsibility as community members to take care of each other and to do prevention. And the last thing we always want to do is make sure that we're giving people a place to go. So we don't want to tell them that, the house is on fire without telling them where the exit is. We want to make sure that we're helping them understand that this is a problem. Here are the facts of the problem. Here's why it's our responsibility to do something about it. And here's what we can do about it. So making sure that we're giving people access to, here's how to get your prevention involved. Here's how to get the folks in harm reduction involved. Here's how to get, if you're more interested in recovery supports, here's how to get access to treatment. Making sure that we're representing all of the parts of the continuum, and any call to action is really important too, because we know that when our folks in recovery are doing good recovery, they're doing great prevention too. So it's important that we're representing all of them and sharing that call to action to make sure people have a place to go with the information we're giving them, what to do next. And lastly, I want to give folks a place to find me. Like I said, I recently was the Director of Substance Misuse Prevention for the Capital Area Public Health Network, which is here in New Hampshire. And I am now a consultant for prevention. And so these are just some of the things that I've been doing over the past almost 10 years since I started doing prevention. And yeah, so thank you again for all of your time today. And if there's any way that I can help or support you, or if you have any questions from the materials, please don't hesitate to reach out. My email's on the slide. And next, I'm going to be introducing Michael.
Good morning, everyone. Thank you so much, Ani. I think this is such a great segue in discussing messaging, because the product that I developed is focusing on using social media to support youth cannabis prevention. I have been using social media as part of our prevention efforts in New Haven, Connecticut for the last 4 years. It has been a major lifeline for connecting with youth, particularly during the pandemic. I know a lot of you probably saw a pause happen in the work with youth, and this was a way that we could continue doing fruitful and meaningful work with our youth stakeholders, and deliver those prevention messages and information to them in real time. And as a result, it's something that we've institutionalized, and we've continued to move forward as a best practice for our work here in Connecticut. So a little bit about me. I am the chair of the New Haven Prevention Council. I served as the prevention coordinator for the city of New Haven for the last 4 years. And in doing that work, got to collaborate with the New Haven Public School District, with the Governor's Prevention Partnership, who is on the call today, with our State Department of Mental Health and Addiction Services. And we have taken a deep dive into looking at how social media can be used as a tool to deliver prevention in a really, really different way that we haven't seen before. I am sure this is a very ubiquitous topic for all of you, depending on how you've utilized social media in your work thus far. Some of you might have just scratched the surface. Some of you might have been doing this for years. So this is really a tool that is meant to address the entire gamut of experience when it comes to using social media. So moving to the next slide, you'll see that this is something that will be useful for preventionists and community coalitions. I introduce you to what social media is, because it is really so many different things today. It's different applications, it's different platforms, it's different websites, and different modalities for communicating, interacting, sharing, collaborating. And what you see today are just an evolution in the different types of platforms that youth are using. So actually, this is something that I hope to develop updates on in the future. So the version that you'll see posted here is just the version that will be applicable for 2022. But moving forward, I actually want to make updates to this and share different additions that can be helpful to you and your work, because social media is constantly in flux, it's changing, it's evolving, and there are new platforms that are popping up just about every year. So what are the roles of social media in cannabis prevention? This tool will really help you take a close look at what the role social media is playing within your community. So in looking at this model here, you see that social media can serve as contagion, so can actually undermine any public health efforts that are trying to counteract the use of cannabis, especially for youth. It can serve as a vector to enable risky behavior. So thinking about the buying and selling of cannabis via social media as a major issue that we haven't really grappled with facing in our prevention work. It can serve as an inoculant to actually increase public awareness. So this is where we sort of see the shift in how social media can be used as a tool to undermine public health, to actually be used as a tool to promote prevention. It can be used for surveillance, and the guide will teach you how to use social media as a way to conduct your needs assessment. Believe it or not, that initial step of the SPIF model can be used as disease control to positively influence healthy behaviors and promote alternatives to cannabis use. And it can also be used to increase access to interventions and treatment. Moving to the next slide, I also provide you with a host of information on the peer-reviewed literature related to social media and cannabis use. So the quick and dirty on this is that there is a positive relationship between consuming social media that includes marketing around cannabis and eventual cannabis use. So we know just from our regular use of social media that businesses are using it as a primary form of marketing. And believe it or not, they're not pouring much money into it, because youth themselves are the catalysts for this. Youth are the ones that are directly sharing the information. They are becoming natural influencers for normalizing cannabis use over social media. And as a result, the cannabis industry doesn't need to spend that much money on this because it's already happening. So how does this constant barrage of marketing affect youth acceptability? Does it increase or decrease the odds of cannabis use? How are youth engaging with social media to learn about cannabis? Believe it or not, it's becoming the first source where youth are trying to find information, where they're trying to connect with other youth on ways that they can consume it and consume it safely. And in terms of regulations and applications of policies being adhered to, is it happening? Is it not happening? And moving forward to the next slide, we see that there are so many different platforms that can be used. And I offer just really novel examples here for how you can cater and curate different prevention messages across these different platforms. So we know that, TikTok is notorious for its dance videos, Snapchat for its disappearing content. Community updates are really popular on Facebook, and especially with more seasoned crowds. And the photo and story feature on Instagram is really popular among our youth. So I invite you to look into this for just some really fun ideas on how to deliver prevention via social media. And moving forward to the next slide, I also offer you a roadmap for how to begin your social media journey. Who do you curate this to? Which platform do you use it on? What types of messages will you develop? And when to actually post these messages is always a question, identifying that sweet spot in the day. And I would like to offer some education here on the ICRC domains for our certified prevention specialists. So the guide is really helpful for helping you think about so many of the ICRC domains. I provide really in-depth information on how you can use social media around planning and evaluation. There are different metrics on social media that can help you gauge responsiveness to coalition activities and services. In terms of education and service delivery, thinking about how you develop authentic and relatable messages that can be delivered through experts who can share this information and avoid some of those negative messages that Ani was speaking about. And then using social media to market the prevention and treatment services in your community. And finally, going through these last domains, how to use social media for communication, such as the direct messaging feature on Instagram, doing group chats, live videos for that continuous connection. Again, I want to underscore what a lifeline this was for continuing our prevention work during the pandemic, and how it has carried us forward to sort of hit the ground running now that schools have reopened and are back to full capacity. To connect to Jeanette's product, thinking about community organization and thinking about how we can mobilize community. Social media is a great tool for identifying and collaborating with your 12 sectors. And lastly, bringing it back to you, how you can use social media for your own professional growth, how you can use it to highlight the accomplishments of your coalitions, the outstanding work that you're doing with youth, so that you can share it with media, so that you can share it with your local city representatives, so that you can share it with your funders, so that they can actually see the awesome work that you are doing. And I share here all of my socials so that you can get in touch with me if you need any technical assistance or support around building your social media presence for your community and for your coalition. You could just feel free to screenshot this and get in touch with me through any of these modalities. I also want to thank our generous funder, SAMHSA, and the New England PTTC for just a phenomenal fellowship experience. It's been awesome taking work that has been in my head for the last few years and being able to put it on paper and into a product that hopefully all of you will find useful in your work. And lastly, a big shout out to the New Haven Prevention Council, the One Step Program, and the Connecticut Department of Mental Health and Addiction Services. And so last but not least, I would like to hand it off to FJ, who will actually bring all of today's presentations together in his awesome product.
Thanks so much, Michael. No pressure. You've all set such a high bar, and it's been wonderful working with all of you. And thank you all for joining us today. I really appreciate all of your curiosity and wanting to come into this space and learn more about our products. You know, like Dan, I enjoyed the program so much last year, I decided to apply, and I'm really grateful to have been accepted for a second year. And so I'll talk a little bit more about how my first product connects to this one. I really see this one as a companion piece. But before I do that, I also want to thank Sarah and Scott and all the wonderful folks at the PTTC, for which this opportunity would not have been possible without. And for all of the people that I worked with, my wonderful cohort, I learned so much from you this year. It really has been a sort of passion project for all of us. And I also wanted to make sure that I was able to tie all of your wonderful work into my piece. So hopefully that becomes more clear as I move along. So my product was called Restorative Practices and Prevention, taking a relationship-based approach to preventing youth cannabis use through restorative practices. It's a guide for youth serving prevention programs, and really, I think, a guide for anyone who is working with youth. And so I just want to touch on the IC and RC domains that I focus on, because I do think it's really important to reinforce this notion that what we do requires sort of a professional background or professional grounding. I think that's sometimes lost in our prevention work. And so my product covers really all of the 6 domains, but focuses primarily on domains 2, 3, and 5. And that's prevention, education, and service delivery, how we're doing our work, communication, community organization, and professional growth, how we're growing through our work, and public policy and environmental change, which is domain 5. How are we sort of sustaining our efforts, our work? And so before I dive into it, a little bit about myself. My name is FJ Perfas. I am the Massachusetts Fellow. I have been in this field for 15 years now. I am the Assistant Director of Prevention at the Department of Public Health in Massachusetts, in their Bureau of Substance Addiction Services. I've been here for my entire career. So I've been a preventionist for my entire career in public health. Fun fact about me, I started this work as an intern. I started in my office as an intern, and I was an intern in a pre-med program. And I made the switch over to public health after I learned just how powerful public health is, and really grew to sort of appreciate sort of the value of preventing problems as opposed to treating them, which isn't to say it's not important to treat problems, but for me, I found my calling to be public health. And so just a little bit about me. The last thing I'll say about myself is when I'm not talking about prevention work, I'm out enjoying the wonderful mountains and ocean of New England. And so I'm really happy to be living here in the Northeast. Okay, so I thought it was important to acknowledge that, if you can't read what this picture says, it says, "United we stand, divided we fall." We live in a pretty divisive time, I think, as we can all see in the politics of our work and the politics of our country. And I think that's really important to acknowledge, because I think even in the midst of our public health work, particularly as we're talking about substance misuse and everything that sort of comes with it, and the changing landscape of cannabis, we can really get trapped in politics and feel like we have to operate in this sort of either or environment. And I'd like to propose that there's a lot of ways we can sort of honor and acknowledge everyone's sort of lived experience and personal truths. And so I think, what better way to sort of acknowledge that in the way we do our work? I think so much of our work is compartmentalized. And I think that's by design. When we talk about, I'm sure everyone's heard this sort of idea of sort of breaking down our silos, but our systems are designed as silos. And so we're going to have to do more than just acknowledging that, and really be intentional about how we work together. And so I hope through this product and sort of what I talk about today, you can get a better sense of what that might look like in our work. And so let's see here. So the vision for my product, I wanted to keep it simple, because I think it's pretty simple. It's not easy. I think those are two very different things. And I think it's simple because really, I think what our work is trying to do is just create a better quality of life for folks. My product is really trying to promote this vision of restoring people in our communities to sort of a state of wholeness. And what I mean by that is, allowing folks to thrive and live to their fullest potential. There's so many things that happen from a very young age that sort of impact our ability to just live our lives to our fullest potential. And so this idea of restoration to a state of wholeness is just that. How much do the decisions we make and the things we do and what we're exposed to at a very young age impact that and start taking pieces of ourselves away from us? And so that's my idea, in terms of what I mean by restoration and how I'm applying it to this work. And that's the vision for this product. I realized too that I did not include a picture of my product. And so you'll just have to go to the site to check it out yourself. Let's just say that was intentional. It really was an accident, but I'm going to say that was to drive folks to the website. But I would encourage you to go to the website. I think that is live now, and that's where you can find all of our resources. And so, as I said before, the purpose of this guide is really just, supporting community prevention efforts, really focusing on keeping youth healthy, focusing on youth wellness. I think it's really easy to sometimes get so hyper fixated on a specific issue that we almost forget that the whole purpose of our work is to just keep people healthy. And so, that's really the purpose of my guide. How do we focus on youth health, and particularly around this evolving cannabis landscape? And sort of from my perspective, I think restorative practices offer us a lot of different ways to do this without causing harm. I think, sort of building off of what Dan said, and for those of you who work with youth in schools and other youth settings, I think we can all appreciate this idea that, a punitive approach isn't the most effective approach. Maybe in the short term, it can be effective. And I think in the long term, anything that's punitive, that's effective, I would say is trauma. And so I think if we're trying to make sure we sort of adhere to this, in some ways, Hippocratic oath for preventionists, right? Causing no harm. I think we need to continue to explore other ways of supporting youth that don't involve punishment, and that really sort of focus on promoting assets and sort of the strength and resilience that all of our youth have. And so the last thing I'll say is part of what I've integrated into this product is a lot of lessons we've already learned. This isn't new territory. This isn't a new landscape. It's nuanced in that it's focused on cannabis, but we've learned a lot of lessons in the work we've already done around preventing youth from drinking alcohol, preventing youth from using tobacco, and so many of those lessons apply to our work. So I think other people have said this: how can we not reinvent the wheel, and how can we not feel like we're just adding more work onto what we're already doing? I think many of us are already doing this work. So how are we able to understand how it applies to this changing cannabis landscape, and how can we speak about it in different ways, as a lot of my other colleagues have already spoken about? And so those are some of the other things that you'll find in this guide. Yeah, there's already a lot of things that we're doing based in evidence, based in experience, that can apply to this changing landscape. And acknowledgements is something that I feel is the first place to start. There's so much historical trauma with the different people we're trying to serve in our communities. There's so many different things that even just looking at youth that they've experienced that deserve to be acknowledged. And so I think this can be meaningful when we acknowledge our own sort of historical traumas, whether it's acknowledging the land that we live on, the land that we work on, the land that we play on, whether we acknowledge some of the things that our systems, the very systems of health and wellness, have contributed to in terms of the problems we're now trying to address. There are a lot of ways that our health and care systems have contributed to some of these issues. And I think it deserves to be, if not acknowledged, at least explored. And so I think acknowledging these things are a really important place to start, because I think a lot of our work depends on relationships. And not just interpersonal and personal relationships, but deeper relationships. What's our relationship to this work? What's our relationship to some of these issues? How do we maintain a balance and maybe even a boundary between our own personal beliefs and sort of our professional responsibilities and duties? So that's some of what I sort of explore in this guide, sort of setting some of this up so that people can make the connection and understand sort of the relevance between sort of a restorative approach or restorative practices to our work. Okay, and sorry, I'm trying to keep up here on my end. And so, in talking about in the next slide, what does this mean to sort of apply this to our work, and what does this work look like in practice? And I think, do I have another slide, Sarah? There it is. As I said before, talking about how our work occurs in silos and actually breaking those silos are two very different things. And I think one of the things we need to do a better job of, or we can do a better job of, is really being intentional about collaborating. And I think that's something you've probably heard a lot before. And so how I'm hoping to sort of model that in some way is throughout my product, all of my colleagues within this cohort, their products are featured because their products dive even deeper into some of the areas that I touch on. And so why not hear from my colleagues themselves? And so each of the products that they've produced this year, as it sort of touches on specific areas of my product, you'll see that there should be a link to their product. And I think just to sort of take a couple steps back, my product also attempts to kind of create a place where you can find a lot of this information, hopefully in just one resource. So many different things, from historical context to a lot of these more specific, policy recommendations are kind of scattered throughout the internet and in different books. And my hope is to create sort of a foundational place to start with a lot of that information in one resource. And from there, hopefully leading you to other resources like my colleagues' products that can take you into an even deeper dive on specific issues that might be more pertinent to you or where you are within your journey of preventing cannabis misuse among youth. And so I think the last slide is just sort of a call to continue to work together. This is not an exhaustive product and not an exhaustive resource. And so really the hope is that we can continue to define what a restorative approach looks like together so that we can in turn do this with our communities. I think it's, we often take a position of, a well-intentioned but sometimes misguided approach of sort of making decisions for the folks we're trying to serve. So how do we really intentionally center them in our work and allow them to define the work in the way it should? And so I think that might be my last slide, Sarah. Yeah. And so again, thank you, everyone. And I look forward to hopefully working with some of you more closely around supporting you in your sort of prevention efforts. So thank you.
Thanks, FJ. Okay, so you have now heard from all 6 of our fellows about the resources and products that they have created over the course of the last 7 months. And we're now going to open it up for questions, thoughts. If you have questions about the process of the fellowship program or questions about any of the specific products. I saw early on in our conversation, Ramona asked if Dan's program addresses vaping as well as smoking marijuana, cannabis, which Dan did reply to in the chat, but I just wanted to call attention to it for anyone else who may have had that same question. Dan says, yes, it sure does. And with that, I will open the lines. Please feel free to unmute and ask a question or pop in the chat, and I'd be happy to read that out for you. No pressure, Ani says. I would love to believe that we've done such an excellent job explaining the program and the products that everyone is just crystal clear. I don't know if that's true, but wouldn't that be the dream?
It looks like there's a question from Lee. We want to address.
Thanks, Scott. How does the cannabis alternatives to suspension compare and contrast to life skills or crime for life? So that's a Dan question.
Yeah, thanks for that question, Lee. So it definitely incorporates elements of other alternative to suspension-esque programs. I'm not familiar with all the details of life skills or crime for life, but I'll definitely look through those to do a better, bigger crosswalk. So I even looked into other cannabis prevention programs not traditionally used as an alternative to suspension. Things like the Stanford Cannabis ToolKit, other resources, and kind of paired that up with some of the research around effective alternative to suspension. So don't have an exact answer about those 2 programs, but happy to look into that. And thanks for the question.
Any other questions for our fellows for their products or anything they may have come across in their research? Oh, Lee says, are the tools considered evidence-based, or are they able to be used from the website and implemented in communities outside of the Eastern region? I think that might be for you too as well, Dan.
I think as far as the first piece of that, the evidence-based, I think probably closer to, promising practice. I think there's a lot of research and evidence to back alternatives to suspensions, just like there's lots to evidence to behind all of our 6 projects. Mine was piloted in a similar version, through with pre and post testing. So there was certainly evaluation as a process to get to this point. But as far as implementing that to fidelity, exactly how it shows up in this piece, I'm not there, but would love to. And I know I have some of our state folks here in Rhode Island on the call. We have a really exciting, our state's epidemiological outcomes work group has a process for creating promising practice here in our state and moving those towards evidence-based programs. So that would be my my next goal with this. And I think as far as it's certainly focused on the case study was very, Southern Rhode Island specific. But a lot of the research I looked at to craft my project was not just, what was working in Rhode Island or New England, but certainly beyond. And not sure if anybody else has anything to add to that.
Yeah, I would add to that, Dan, and say that I think one thing to acknowledge is that because cannabis was the way it was scheduled, doesn't really allow for a lot of research to sort of inform what we would consider evidence-based. But I would say that, and I'll speak a little bit for some of my colleagues here, I would say all of our products are at least evidence informed. And I think, a lot of the conversations that we've been having in Massachusetts is talking about the importance of an evidence informed approach to really, center community voice and experience in a way that it's not found in what we would consider evidence and research that would be part of an evidence-based approach. So I think that's something that I think is worth sort of taking into consideration with our products.
Can I jump in real quick? I think the other point I would make, particularly with Dan's product, is that it's based on the idea of as an alternative to suspension, and we do specifically have evidence that a risk factor for cannabis and young people is, or a protective factor is attachment to school, and a risk factor is punitive out of school suspension. So I think just that practice as an alternative to suspension, in my view, makes it certainly an evidence-based tool resource.
Thank you, Dan, FJ, and Scott. And I would also add, if there are folks on the call who are outside of New England, you are also welcome to use these resources, although they did focus on the New England region. But if there's something you're seeing that can be useful to you in your state, we know that the changing landscape of cannabis is not just New England wide, it is happening all over the country. So you're more than welcome to use these products. I have a question from Antonio for Michael. I'm interested to hear more about the changing landscape on social media, in particular, the cannabis messaging ban on TikTok that the New York Awareness Campaign recently attempted to fight. Did you come across that in your research, Michael?
I did. And, I will be surprised if any type of ban happens. Billions of dollars are poured into these social media platforms every day that are backed by influencers who very well that are profiting off of using these platforms. And I think the rational strategy is to put more pressure on lawmakers to regulate policies and restrictions around what type of content can be shown and can be shared. I think for the most part, when you search some of these very provocative hashtags that are related to cannabis or vaping or really any other substance, they do a good job at making sure that that type of content isn't shared at least to the masses on a daily basis. And there are reporting features that you and I can use if we do see content that somehow slips through the cracks. But it's incumbent on us, I think, to instead focus on how we educate youth to use social media safely, how we work with parents to make them more aware of what their children are looking at and what their viewing content contains, because this is something that for the most part will continue to be unrestricted. This is something that is going to continue to grow and expand way beyond our reach. I mean, just look at the metaverse and the things that they are currently proposing. You know, there is no way for us to get a 100% grasp on what's happening. So we have to educate our young people, our community members, our lawmakers, our families on how to use this safely and limit its use so that it doesn't take over, because we're really on that road right now.
Thanks, Michael. Another question in the chat, Kristen Erickson, who is one of our fabulous team members at the New England PTTC, asks, if someone were to be brand new to cannabis prevention, what resource or product would you recommend as a starting point? And I've seen a couple of the fellows answer that question in the chat, and I'll just ask the fellows, unless you have a burning desire to shout that out loud, if you could answer Kristen's question in the chat, and then we can have a written resource list for that. I also see a question from Patricia. Where can people find these toolkits? Where are they going to live? And that is a great transition for me. Thank you, Patricia. I promise I didn't pay her to ask that question. Those are going to be on our website. Erin has the link for our website, and she is going to put that in the chat, where you can find all 6 of the products from this year. We wanted to save it for the very end so that all you curious minds didn't click out and start looking at the products before we were finished presenting them to you. So now that we've talked about all of them, we will give you that link so you can go and explore at your leisure. And we have just about 5 minutes left, so I have a couple more questions in the chat I'd like to ask as we near the end of our time. But before we do that, I will also say Erin's going to put in the chat a link to our evaluation for today's presentation for our symposium. We would ask that you would all take a minute. It's very brief, maybe 3 minutes, to complete that evaluation. It's very helpful to us to see how useful this resource, this symposium was for you, what you got out of it, what you took away from it, and how we can improve our presentations to you for the future. So that is my humble ask, that you complete our GIPRA evaluation that Erin will put in the chat. And with that, a couple more questions for our fellows. One is a question from the other Ramona. How have prevention efforts addressed non-English speakers, especially using social media? Are there certain platforms that are better to use? I don't know, Michael, if you maybe have an answer to that from your research.
Absolutely. You know, one of the nice things about social media is that you can curate it to your community. So, you know, don't use the thumbnails from the internet to develop your messaging. Use youth from your community who speak the language of your community, who live in your community, who know the places that youth frequent, and can make messaging as attractive and as curated as possible. So one of the things that we do in New Haven is we have a influencers program. We are funding youth that can be role models for what positive, healthy behaviors look like, and make it accessible and make it fun and make it relatable. Don't just make it something that's sort of like cookie cutter textbook design for what prevention should look like. Make it attractive for your audience. And we have a group of youth stakeholders who are constantly providing us feedback. And one of the good things about social media is that it provides you with metrics. So you can essentially evaluate if your messages are landing with your audience or not. If it's getting lots of likes, if it's getting lots of shares, if there are comments happening. Those are all indicators for if your messaging is working or not. And you tend to pick up tricks as to what is attractive to your audience. You know, we know that when we feature youth front and center in our social media, that tends to get more likes and shares and comments and saves. And that means a lot, you know, versus when it's someone like an expert in the field that's just coming on and doing educational videos that might not have as much credence for our youth. So experiment and try different things and see what gets a better response and better reaction from your youth. And when it does, do more of that.
Thank you, Michael. I think we have maybe 30 seconds for your question, Astrid. Do you think you can
great.
do it?
I have a couple of things that come up. I'm thinking about siloing. And then Annika's product is a toolkit with harm reduction lens. And because we're so siloed, you know, harm reduction is siloed separate from prevention. I'm thinking about how is this a useful tool for prevention folks to use? I'm assuming it is because I haven't taken a look at it yet. And then the other thing is, considering that the US government does have a patent on the cannabis plant, I'm wondering what might we do to help reschedule cannabis so that research can flow our way, so that we do have more information, so that we can have more evidence-based programs. And an article in there that was listed in the Denver Post about the patent, but the piece about the harm reduction lens, is your product, Annika, useful for prevention folks as well?
Definitely, yeah. It's for prevention professionals and communities. So it's a part of it is kind of a like, here's harm reduction 101, just a real quick, here's why we're similar, here's why we should be working together. So it's for prevention specialists to use a harm reduction lens. So it's definitely about breaking down those silos. Thank you.
Thank you.
Thanks, Astrid. Scott, I don't know if you wanted to throw in a little bit to Astrid's last question and then we'll wrap up.
I guess I would just add, I know that the Biden administration is looking at, when he did the pardon, the one thing that they were going to be looking into was the scheduling piece. So I do think that's something the administration is going to be looking, and there is a certain process that goes through, a certain review process. So I think we'll learn more about that in probably the year to come.
Thanks, Scott, and thanks, Astrid, for your questions. I know there was a couple more questions in the chat we didn't have time for, but please, please, please feel free to reach out to the fellows directly, and you can reach out to us as well at the New England PTTC. I just put all the fellows' emails in the chat, so grab that, take a copy of that, and I can put it in our follow-up emails as well to folks, so you can have the emails for all these wonderful people. Thank you to our fellows for a great term. It's been really wonderful working with you, and I'm so excited for the field to have these products now available on the Changing Landscape of Cannabis. And thank you to everyone who joined us today. A really great discussion at the end. I wish we had more time for, but with respect to your time, thank you so much for joining us. Please take our evaluation. Please reach out to us about any of these products, and we will be seeing you soon. Thank you.
Thank you, everyone.
Okay, I think it's just us left. Woohoo! Oh wait, let me hit stop recording before I like really gas you all up here.